you don't know basic anatomy, when I talk about pathology, you won't know what I'm referring to, right? So if I say that the body of the vertebrae is fractured, if you don't know what the body of the vertebrae is, you have no idea what that fracture is. Right? So you need to know basic anatomy of the spine. Okay. For the T-spine, right? Main things to know, how many thoracic vertebrae do you have? 12, great. And each thoracic vertebrae has a pair of what? Ribs, that's right. It's got a pair of ribs coming off it. Okay. Lumbar spine, how many do we have? 5, very good. And once we get past the lumbar spine, what do we have instead?
Sacrum and coccyx.
Sacrum, great. Sacrum and then coccyx. Okay. So we talked about some Nope.
What is that for, Mr. Phung?
So that thing you can see this.
Make sure you get the contrast right.
Close enough. Okay. Alright, so right, we talked about our facets. Right, we have unilateral and we have bilateral dislocations, right? Okay. Bilateral, of course, is going to be the more dangerous one. Okay, but unilateral is also a big concern. We need to be careful of both types when dealing with trauma patients. It used to be that every time a patient had trauma, they would get a chest x-ray and a C-spine x-ray. Nowadays, they only get chest x-rays. Any idea why? Any idea why they don't do C-spine x-rays anymore? Like if there's a car accident, a patient will always get chest x-ray and then C-spine x-ray. Jamaica.
Because they don't want to do any further damage just in case there is.
No, we want the x-rays to see if anything's going on.
They send them to CT.
Yes, they send a patient to CT instead. Right? Instead of doing x-ray, they do CTs. The CTs are more detailed, especially for this type of anatomy.
So they do the X-ray for the chest and then send for the CT for the spine.
Correct, they do, yes. So pay attention when you go to a trauma case, when you go to shock room, right? Especially if you go to a code, like a code 1. Take a look, pay attention to the order in which they do things. Right, they'll check vitals, they'll get an X-ray, and then they send them to CT. It's almost always in that order. If they don't, it's because they do vitals, they do X-ray, and then they send them to surgery. And they skip the CT. So just pay attention when you go to shock room. All right, fractures. We had our clay shoveler. Right, this one was of the spinous process. We have our chance fracture. Okay. This one